Okay, so we're having an overview on the urea cycle disorders. Just before we start talking about them one by one, So for the urea cycle disorders, for the overview, we say that they're actually a group of rare genetic metabolic disorders. So they impair the body's ability to be able to remove ammonia. Right. So ammonia is a toxic byproduct of protein metabolism. So this actually leads to ammonia levels actually getting so high in the body. So for the types we have, basically the disease conditions are occurring around this cycle. You understand? So if there are deficiencies of enzymes at any step, then you basically have the disease conditions coming through. So we have the N-acetyl synthase deficiency. It impairs the first step. You see it here, right? So the N-acetylglutamate synthase is actually the enzyme that is lacking there. Then we have the Carbamoyl phosphate synthase 1 deficiency. It leads to severe ammonia buildup. We have the Ornithine transcarbamylase deficiency. Then alright, so this is the first one. This is the second one. You understand? So we have the Argininosuccinate synthase 1 deficiency, also known as Citrullinemia type 1. Alright, Argininosuccinate synthase deficiency. Then we have the ASL. So ASL is Argininosuccinate lyase deficiency. Causes argininosuccic aciduria. Then we have the Arginase deficiency. Alright, this is the Arginase enzyme deficiency. So just going around the cycle. Alright. Then we have the ornithine translocase deficiency. This one disrupts ornithine transport, affecting ammonia clearance. So symptoms is if it's in a baby, that's like you're just giving birth to this problem. There are several things like poor feeding, vomiting, lethargy, seizures, comas. If it is late onset, that's like the person is presenting in like adulthood. There's behavioral changes, confusion, protein intolerance, and recurrent vomiting. So diagnosis is just blood test because you want to actually assess for the levels of ammonia in such a patient. Genetic testing because you want to identify the specific genes that have the problem. So treatment is low protein diets because you are lacking the enzymes that will break proteins appropriately, nitrogen scavenging drugs, and liver transplantation in severe cases.